Hello, welcome to Medico's World. In this video tutorial we will learn, what is diabetes and what are the early signs and symptoms of diabetes. Diabetes is a chronic, long-lasting, health condition that affects how your body turns food into energy. Your body breaks down most of the food you eat into glucose and releases it into your bloodstream. When your blood sugar goes up, it signals your pancreas to release insulin. Insulin acts like a key to let the blood sugar into your body's cells for use as energy. With diabetes, your body doesn't make enough insulin or can't use it as well as it should. When there isn't enough insulin or cells stop responding to insulin, too much blood sugar stays in your bloodstream. Over time, that can cause serious health problems. Following are some early signs and symptoms of diabetes. Both types of diabetes have some of the same warning signs. 1. Hunger and fatigue. Your body converts the food you eat into glucose that your cells use for energy. But your cells need insulin to take in glucose. If your body doesn't make enough or any insulin, or if your cells resist the insulin your body makes, the glucose can't get into them and you have no energy. This can make you hungrier and more tired than usual. 2. Peeing more often and being thirstier. The average person usually has to pee between 4 and 7 times in 24 hours, but people with diabetes may go a lot more. Why? Normally, your body reabsorbs glucose as it passes through your kidneys. But when diabetes pushes your blood sugar up, your kidneys may not be able to bring it all back in. This causes the body to make more urine, and that takes fluids. The result, you'll have to go more often. You might pee out more, too. Because you're peeing so much, you can get very thirsty. When you drink more, you'll also pee more. 3. Dry mouth and itchy skin. Because your body is using fluids to make pee, there's less moisture for other things. You could get dehydrated, and your mouth may feel dry. Dry skin can make you itchy. 4. Blurred vision. Changing fluid levels in your body could make the lenses in your eyes swell up. They change shape and can't focus. Symptoms of type 1 diabetes. You might notice unplanned weight loss. If your body can't get energy from your food, it will start burning muscle and fat for energy instead. You may lose weight even though you haven't changed how you eat. See which foods are high in trans fatty acids. Nausea and vomiting. When your body resorts to burning fat, it makes ketones. These can build up in your blood to dangerous levels, a possibly life-threatening condition called diabetic ketoacidosis. Ketones can make you feel sick to your stomach. Symptoms of type 2 diabetes. These tend to show up after your glucose has been high for a long time. Yeast infections. Both men and women with diabetes can get these. Yeast feeds on glucose, so having plenty around makes it thrive. Infections can grow in any warm, moist fold of skin. Slow healing sores or cuts. Over time, high blood sugar can affect your blood flow and cause nerve damage that makes it hard for your body to heal wounds. Pain or numbness in your feet or legs. This is another result of nerve damage. Signs of type 2 diabetes complications may include slow healing sores or cuts, itchy skin, usually around the vaginal or groin area, frequent yeast infections, recent weight gain, velvety, dark skin changes of the neck, armpit, and groin, called acanthosis nigricans, numbness and tingling of the hands and feet, decreased vision, impotence or erectile dysfunction. In diabetes, you might get hypoglycemic or hyperglycemic, in which you can feel these signs and symptoms. Hypoglycemia. Hypoglycemia, or low blood sugar, happens when the level of sugar or glucose in your blood drops too low to fuel the body. You might feel shaky, nervous or anxious, sweaty, chilly, or clammy, cranky or impatient, confused, lightheaded or dizzy, hungry, sleepy, weak, tingly or numb in your lips, tongue, or cheeks. You might notice fast heartbeat, pale skin, blurred vision, headache, nightmares or crying when you sleep, coordination problems, seizures. Hyperglycemia. Hyperglycemia, or high blood sugar, causes many of the warning signs of diabetes including heavy thirst, blurry vision, peeing a lot, more hunger, numb or tingling feet, fatigue, sugar in your urine, weight loss, vaginal and skin infections, slow healing cuts and sores, Blood glucose over 180 mg per deciliter milligram per deciliter. The warning signs can be so mild that you don't notice them. That's especially true of type 2 diabetes. Some people don't find out they have it until they get problems from long-term damage caused by the disease. Immediately consult doctor if you notice any of these signs and symptoms. Thank you for watching Medico's World.